Alright, hello everyone from Richardson Hospital. Here we have a patient on post-operative day 7 and this is after a Bijaw surgery, meaning work has been done on both the jaws, the maxilla as well as the mandible, upper jaw and lower jaw. So this patient's case is quite interesting because he came to us with such a bite where his mandible was totally shifted towards one side. In this, if you can see, his lower jaw, his lower teeth are over the upper teeth, which should be ideally the other way around. Also, on the right hand side, his mandible is completely towards the right. That means his upper teeth and lower teeth are not touching, they are not occluding. Now let's look at his profile so that I can tell you what all changes have been done. Alright, so this is how he looked pre-op. If you notice the side profile carefully, थोड़ा सा आप ऐसे हो जाओ, हाँ, side में देखो. If you notice, he has a classical skeletal class 3, which means his lower jaw is prognathic, it is forward, but now his profile is straight. Okay, आप एक बार smile करो. So he won't be able to smile much. You can see there is very much visible edema present. थोड़ा सा. Now if you notice his teeth carefully, his upper jaw, his upper teeth are occluding over the lower teeth. That means there is a positive overjet of 2 mm, which is ideal, and overall his occlusion is perfect. His molars are seated very well in angles class 1. So teeth wise, dental correction, we have corrected the occlusion completely. There is no high points. Whatever that was has been corrected too. Skeletally, his profile has been changed to class 3 to class 1. That means he has a straight profile when we look from the side view. Now the third thing what I want to explain to you is what has been done exactly. What goes into a Bijaw surgery is when we work on the maxilla, this is his pre-op scan. You can see, as I explained earlier, the clinical signs of the mandible being shifted towards the left. So we have done a LIFO 1 superior rotation as well as bilateral sagittal split osteotomy. Therefore, you see these 2 plates on both the sides. Now he has a stable occlusion. So there are 4 plates up. So that's about 16 screws, and again 4 screws here and 4 screws here on the mandible. So this is the surgery that has been performed, and this has helped us to achieve a stable occlusion, a straight profile, a better function, and he will be able to speak more properly, eat, chew more properly. All his problems, basically what he came to us with, have been solved. Although at this point there's going to be a lot of swelling, and since a lot of bony work has been done, he has to give his body at least 1 month for all the swelling to come down, and his final results will be noticed in the coming few months. आपको कोई डाउट है, कुछ पूछना है या समझ में आया?
सिमेट्रिकल है तो बाकी सब ठीक है।
यस, सिमेट्रिकल है. देखो आपका यहाँ पे मिड लाइन भी मैच कर रहा है. ओके, यहाँ पे आपका मिड लाइन देखो, ये राइट साइड में, ये पूरा लेफ्ट साइड में. इसे ये देखो सीधा, ये थोड़ा आड़ा है. ठीक है. सो जब हम अपर जॉ लोअर जॉ करेक्ट करते, ठीक है, तो एक बाइट आना चाहिए नॉर्मल, जैसे लोगों का बाइट होता है वैसे आपका आ चुका है, पर आपको बोन के ऊपर इतना काम करने की वजह से बहुत स्वेलिंग रहेगा. थोड़ा मुंह खोलने में तकलीफ होगा क्योंकि दर्द है, स्वेलिंग है वो थोड़े दिन में ठीक हो जाएगा। ओके, ऑलराइट, थैंक यू।